Dr. Allison. I'm super excited to have a chance to chat with you about pelvic floor therapy and pregnancy. It's always been a passion of mine being a mom and going through pregnancy and labor and delivery 12 years ago, but also I'm currently 30 weeks pregnant with a baby girl who's due in January, and so right now I'm in the trenches and actively going through everything that I talk about with my patients. So it's one of those things that oftentimes with pregnancy, it's so about the baby and everything you're asked. Are you eating enough for the baby? Are you getting nutrition for the baby? Are you staying hydrated for the baby? Make sure you're exercising for the baby. I think pelvic floor therapy, one of the great things about it and what I love about it is it's focused on you, right? And so you come in and you are going through this huge change in your life and your body's changing, your body's reaction to things are changing, you're prepping for this huge marathon. And that's a lot of stuff that your body needs to get used to and your brain has to wrap around. Shortness of breath, for example, even just talking in these 2 minutes, I feel a little bit short of breath. It's going to be okay. And things change in your body, so it affects your shortness of breath. But when is that shortness of breath too much? And when do I go talk to the doctor, right? And so understanding what those myths are out in social media and kind of weeding through those myths versus having some accurate information can be super helpful, and it put a lot of people at ease. I think something I run into a lot is people reading things online, reading things on social media, or getting books and being fed information that isn't research-based. And that can be really challenging because there's a lot of information out there on pregnancy, about labor and delivery, about life after pregnancy. And so we want to make sure that you're being educated in what is supported in the research, that we're kind of squashing myths and making sure that you're feeling confident in your own decisions, and making sure that you can advocate for yourself when something comes up. And then of course we're prepping for this labor and delivery, which is a huge marathon, and women have gone through it for thousands of years, but it is a big change on your body and it can cause trauma, but understanding how to advocate for yourself is so key. Having a plan, but being flexible with that plan is so key. And so I really love that part about my job, about creating this safe space, having those open conversations, asking questions, answering questions. Prepping for that labor and delivery can be a lot. And we want to make sure that you get as much information as you can without feeling overwhelmed so that you can make those educated decisions. And then of course, knowing what to expect afterwards. If someone told you, oh, you're going to have ACL surgery, a lot of women in their mind would be like, oh, it's going to be a long road to return to recovery. And with labor and delivery, so often we see in movies, on social media, in books and magazines, just this false presentation of everything's back to normal within weeks. And there is a tissue healing time frame, and it's super important that we allow our bodies to heal with a supportive movement pattern, getting the right exercises in, returning to activity, keeping ourselves safe, discussing things like prolapse, which can be very frightening for people, and understanding that it's something that can be expected and it's just the movement of organs. And so there's a lot of topics around movement as well as around tissue healing and around exercise, around how our body changes that can be brought up in pelvic floor PT. I just love having that opportunity to be with someone and provide that education and get my hands on them and help them move their body as it's changing to make sure they're feeling good and feeling strong, especially going into this new chapter in their life where they're caring for this tiny individual who can't do anything for themselves. And so I'm here to tell you that there are support teams out there, and a pelvic floor therapist is part of that team, and I would love to be a part of your team. I also am super excited because I'm welcoming a little baby girl in January. I'm about 30 weeks pregnant right now, 29. And so I'm sharing my story also and using my education and experience to help those around me and my patients feel more confident and empowered within their journey and be able to advocate for themselves. And so I really look forward to working with you, to answering your questions, and to meeting this challenge together. Have a wonderful day.